Kaur,
Harpreet Gaman,
Navdeep Dhaiwal,
and Pradeep Chema.
What is ADHD? Definition: a chronic condition including attention difficulty, hyperactivity, and impulsiveness. ADHD is one of the most common neurodevelopment disorder of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. These are some facts. What the symptoms of ADHD is: difficulty sitting still, daydreaming, disorganization, trouble getting along, carelessness, and excessive talking.
So the diagnoses include it may involve brain scans that measure the activity of the brain and the blood flow, and some of the other diagnoses include functional MRI, single photon emission computed tomography, PET scan, neuropsychiatric EEG based assessment aid system. And these are the effects that can cause on your brain. So low density of gray matter, abnormalities in the structure of the white matter, lower than normal total brain volume, reduced size of some parts of the brain, slower than normal cortical maturation up to adult life, reduced cortical thickness in adults, especially of the cortical network responsible for focused attention. Some of the treatments for ADHD are stimulants and atomoxetine. So the stimulants are the most common type of medication that we use to treat ADHD. There are only two stimulant medications that we use, which are methylphenidate and dextroamphetamine. The second one is atomoxetine. It's considered a second-line treatment for ADHD. It can also be used as a first-line treatment in some children and adults with ADHD because of its efficacy and classification as a non-stimulant.
treatment, tricyclic antidepressants. Tricyclic antidepressants, imipramine, desipramine, nortriptyline have been found effective in numerous studies in children with ADHD. They are used rarely because of their potential adverse effects. Modafinil. Modafinil Provigil has recent placebo-controlled data supporting its efficiency in children with ADHD. This medication may currently be used as a third or fourth line treatment. Causes: brain injury, low birth weight, alcohol, tobacco use during pregnancy, premature delivery. Nursing assessment. Clinical examination to identify the presence of other illnesses with symptoms that overlap with those of ADHD. Interview. A healthcare professional will interview the person with suspected ADHD along with any relevant family members, careers, partners, teachers, employees, or friends to ascertain observations of symptoms, behaviors in different settings, developmental, medical, and psychiatric history, and patterns of ADHD or related comorbidities present in the family. Observations. For children and adolescents, teachers in particular may be especially well placed to identify symptoms of ADHD in children and support system reports from parents. Rating scales. A number of rating scales are available to help assess general behavior and psychosocial functioning, ADHD, symptomatology, and comorbidities.
Nursing interventions. Accept the child or individual as what he is. Approach the child at his current level of functioning. Use simple and direct instructions. Implement scheduled routine every day. Avoid stimulating or distracting settings. Preventions. Some doctors and researchers say that ADHD cannot be prevented. However, it is possible to reduce your child's risk for this disorder by taking steps to promote good brain health. During pregnancy, talk to your doctor or midwife about way to encourage healthy brain development in your baby. And these are the works cited.
Thank you.